Okay. What is your typical day like?
Oh, well, first of all, I don't have a typical day. That's the first thing.
Okay.
Um, as a health director, you usually don't. Usually you respond to both kind of routine things, like signing payroll and making sure vouchers and, these other things, the paperwork's out. And then you respond to emergencies or respond to exigencies, not necessarily emergencies, but things you gotta deal with. So you have to deal with, I might be dealing with a troubled child in a school, because I'm a school medical advisor. I might be dealing with a conflict between the nurse and the student, and how to resolve those kinds of things, how we get those things going. I happen to be involved in housing, so troubled housing is one of the areas that I get involved with, blighted communities and hoarding in situations. Uh, Dog bites, cat bites, skunk bites, all those things fall in public health.
What was your most challenging part of your job? Dealing with
The
public
challenging
health?
part of my job is not the public health part. The challenging part of my job is probably the inner workings of the maintaining the job. That is your budgets, your personnel. Those are the difficult things. The challenges of public health is really, talk about hoarding, you were talking about climate change. Those are the kind of things I love. Uh, that's the briar patch for me. Don't mean that briar patch, I'm fine. But when you start getting into budgets and budget cuts and personnel problems, issues, people with personnel issues and that sort, that becomes more difficult, much more difficult. Recently,
Yeah.
but I haven't had a budget increase in Lord knows how long. Okay, so that's the story of municipal funding. It's just getting, it's just getting bad. And at some point, communities are going to say, well, what do we need? What do we need? And without any degrading of their lifestyles and things of that sort, you have to invest in your infrastructure, your public services has to be there. There has to be a bottom line. You can say, oh, get government off our back, but what do you want government to do? And then when people look up and they say, oh, I thought there was somebody around that would take care of this, or you just can't let this happen. If you don't have a structure, if you don't have any structure, it will happen. The restaurants are just not going to, of themselves, just be clean and food be managed in such a way that it's safe. Water, same way. So there's a lot of stuff that just won't happen just because people say less government. You have to decide what government you want.
What was your favorite change that you think that you've contributed to Milford and making it
Oh,
healthier public place?
oh, that's a good question. And one area we're getting into I'm very excited about is the area of we're going to start to work with the VNAs to do some home visits for our newborns. We're going to go back to the old ways. Oh, it used to be a public health nurse would come out and, every time we had a baby.
Hungry. Excuse me.
Every time we had a baby, which you're not having now, every time you had a baby, you would have a nurse come visit. So we're going to try to offer this similar service here. Next year, we're going to work with the VNAs to do, for those women who want it, or those families who want it, we'll offer a home visit to a firstborn mother. So we're going to try a little bit of that this next year. So we hope that's going to be a very interesting, because evidence is showing that these visits, home visits to newborns, was a great idea in terms of not only the child feeding and developing, but also children, cuts down on abuse and those kind of things to these children. So that's one of the areas I'm real happy about getting going. what would be the advice I would give somebody young coming into public health? Is that a good question?
Yes.
Okay.
From, like, what should I do when I'm graduating or before even?
I think one of the things I do think that, uh, I do think that advanced education helps.